Did you hear that?
I'm not quite sure I understood it. Let me try to repeat it and you tell me if I got it right. How do you tell the difference between somebody with what you're calling a high level of schizophrenia and somebody with a low level of schizophrenia? I don't know what that means, to be honest with you.
And also, what is schizophrenia?
I will. If you look at a person's mental state, you have three basic components, right? You have emotions or moods. Then you have thought and cognition, which really is described by language. And then you have motor behaviors, which may include things like, obsessions and, tics and, those sorts of things. In psychiatry, I think the best classification systems really look to try to understand what's the core disorder in that individual patient. Normally, those three spheres work in synchrony, right? So, for instance, for me, when I see a snake, my heart's going to race. I'm going to experience fear. I'm going to probably utter a few, bad words, and then I'm going to run away. If you ever see me handling a snake, then you know that those three spheres in me aren't together, okay? The best description of schizophrenia phenomenologically, from the person's perspective, the patient's perspective, is when those three spheres are no longer in synchrony. Now, they can have some of the same symptoms as any kind of psychosis. Psychosis from ketamine, psychosis from bath salts, psychosis from cocaine, etc. The difference is that it is chronic and remitting, and there's a continual downhill decline in their cognition, their ability to engage intellectually. Logic no longer, for instance, holds the day. With bipolar illness, they may have very similar sorts of features, but again, the core difference is that they have this mood disorder, and their psychosis, if you will, the thought disorder, the disorder of thought, is congruent with the mood rather than not related. So an example would be, for instance, somebody who tells me that the FBI is after them because they're so great, they have this special knowledge, and they're calling the U.S. attorney and they're doing something about this, versus the schizophrenic who, for instance, says, yeah, the FBI is beaming things into my head, and I'm just going to wear my tin foil, but I'm not too worried about it other than that. It's very blasé. Now, with the high level and low level, I assume you're talking about the acuity of the symptom or the severity of the decline.
Yeah, that's what I mean.
Which ones?
I know some people, for example,
The severity of the decline or the acuity of the symptom?
severity.
Severity of the decline. And again, one of the things that we know from the early autopsy studies in the 1920s is that there were degenerations, basically, in the brains of patients who would be considered to have schizophrenia now. At the time, it was called dementia precox. In other words, a precocious dementia. And so now we're back in that place now where those patients that have that severe decline with schizophrenia really appear to have different brains from the person who has the, if you will, lighter case of it, not quite so severe. It may have to do with when the illness occurred, what the social supports were at the time, and what some of the other factors were involved.